Foreign body in the ear. It's more common below the age of 5, more so between 2 and 3 years of age. And it's usually accidental. Sometimes we don't even come to know they have put something in the ear. When you go to the hospital for the routine examination, and when we examine the ear, we know that there is something inside the ear and we remove it off. But most often, the mother or somebody, the caretaker of the child, they see that the child has put something in the ear. That is one way of presentation. Or if an insect or something has gone inside, when it keeps on moving, it will trouble the child and the child starts crying, starts screaming and holding the ear. So we come to know there is something inside the ear. Now, when you classify the types of foreign body, it can be animate or inanimate. The inanimate foreign body can be metallic or non-metallic. This is how you classify it. The common presentations I have already mentioned, and when you examine, we can do so with the help of a otoscope or autoendoscopy or auto video endoscopy. Where we can visualize the whole thing in a monitor. Now we know that there is a foreign body in the ear. We have to remove it. This can be done in the OPD, or we have to take the patient to the child to the operation theatre to remove the foreign body by giving general anesthesia. When we have decided that it has to be in the OPD, outpatient department itself, first we have to restrain the child properly, which can be done like this, which is called as mummification, or in this manner where the child is held properly in the head, arms and the legs has to be crossed so that he doesn't move. After restraining the child, the foreign body can be taken out with the help of a force. It's a small paper or so, or a cotton ball, or it can be a special small crocodile force as it is called. With that we can take it off, or with a curette like how you see in this picture. And if it is the foreign body is a small insect, we can irrigate the ear with warm saline, which flows in, and as the saline flows out, the insect also comes out. The small ant, everything comes out. So these are the different ways in which the foreign body can be removed. If the child is very uncooperative, which usually happens when there is multiple attempts of removing the foreign body which has been done before coming to the doctor, the child will be very uncooperative. He will not allow the doctor to come near and examine him. The second indication for general anesthesia will be impacted foreign body, which is we are not able to remove it in the OPD. So in these two conditions, we have to give anesthesia so that we can remove it. So we have to admit the child and we will take a consent from you. And in the consent paper, it will be written that in case we are not able to remove the foreign body in the normal routine way, we have to put an incision outside behind the ear and open the pinna like this and make more space so that we can take it off. That will be mentioned in that. So it will be written that the procedure will be removal of foreign body under general anesthesia, and the complications also will be written. These complications are already maybe there is a eardrum perforation which has been produced by the foreign body, especially so if it's an irregular foreign body that is impacted inside. So if there is a eardrum perforation already been made, then sure there will be a hearing loss too. And suppose if it is small eardrum perforation, it will heal within a few weeks. And if it is a large, it takes time and it may not heal sometimes. In that case, we have to do a major surgery which will be planned only after the age of 12 or maybe 18. The second complication is bleeding from the ear. This usually happens when there is multiple attempts already been made before shifting the child for removal. And the last one is hearing loss, which is common if there is a eardrum perforation. These are the complications, and these complications will be written in the consent in which you have to sign and the doctor will countersign. Once that is done, the investigation has been done, we have to meet the pediatrician to get a clearance from him for fitness for surgery to be taken to the operation theatre, and with that fitness we have to meet the anesthetist so that they give anesthesia clearance, that the child is fit for anesthesia. Once that is done, the child will be kept nil per orally at least 4 hours before the procedure. So the child will be taken to the operation theatre, and usually straightforward case needs less than 10 or 15 minutes, but the whole procedure from coming out of the room, going to the operation theatre and back to the room, it takes say about 1 to 1.5 hours, because the anesthetist will take some time, the staff nurse will take some time to arrange, and the procedure will take some time. So altogether you can say 1 hour or so. And once the child come back to the room or to the ward, the child be kept nil per hourly again for next 4 hours, and after that period you have to give sips of water, and the child doesn't vomit, then you can have liquid diet for that particular day, and he'll be getting a course of antibiotic and ear drops too. With that we can discharge a child. So this is in short about foreign body in the ear. Thank you so much.